Okay, so good afternoon. Thank you everyone for joining. Thank you our panelists, our co-moderators. On behalf of the section of medical education, we want to welcome you to this webinar on developing internet-based educational tools that we have put together for all of our members. So today we're going to discuss a couple of items related to some of the webinars that we have done throughout this year. We're going to talk about our moderators and our panelists. We're going to have some, showcast of some of the platforms that we thought were interesting to show around to our community. We're going to have a discussion in regards to, what our panelists had as an experience during the development of the platforms that we had. And then we're gonna have some questions from the audience as well, okay? So we're gonna start with mentioning some of the webinars that we've had throughout this year. You can see the list and you can have them available on the website that's noted below. We're gonna show a QR code of them as well for you to access them after this is completed. And in similar fashion, we're gonna have this webinar recorded for you to review at your own time. Aside from that, we're going to be working on a couple of additional webinars this year that are going to be related to institutional support for med-ed scholarship, as well as balancing some of the parts of clinical and medical education research. We're going to talk about some clinical items as well with discussing feedback, as well as creating a learning environment. And so far, the last one that we have started to work on is about narrative medicine. So with that being said, I'll let my co-moderator introduce herself.
Laura Leuenberger, career faculty at State, and excited to be here and learn about what everyone's been working on.
And I'm Enrique Pacheco. I work in pulmonary critical care at Jefferson University in Philadelphia. We have two excellent panelists. I'll let them introduce themselves as well.
Hi, everybody. My name is Mirna Mohanraj. I'm the Associate Program Director for the Pulm Critical Care Fellowship at Mount Sinai Morningside West in New York City, and also the Vice Chair for Strategic Community Engagement for our Department of Medicine.
And hi, everyone. My name is Daniel Gergen. I'm from the University of Colorado. So I finished fellowship about a year and a half ago. And so I'm attending in our ICU and then also one of our APDs for our internal medicine residency at Colorado.
Thank you very much. So we thought that this was an interesting discussion because of the shift that has developed in the development of digital platforms for medical education. We know that this is a process that probably has been ongoing for about 20 to 25 years, where we started to see some of these traditional methods of teaching being transitioned into the in the internet age. So starting with just a simple structured learning that you can do, these courses that are available online through a question format, then later on adding on video. And then ultimately, after the pandemic, we saw that there was an increase of all of these methods of different ways to deliver education that were available in an asynchronous way, so that everybody can have the opportunity to see great teachers explain concepts, talk about some of the topics that are important in medical education. So we have basically two platforms that we're going to talk about today, or two topics that are a little bit different, but both of them related to medical education. So I'll start by having Dr. Mohanraj talk a little bit about her work with APCC MPD first.
Great. Thanks so much, Enrique. So I'm actually going to touch on two separate digital platform education modules or programs. This first one is actually an institutional program that we developed here at Mount Sinai. You'll see here in the blue box, this might sound familiar to you. We have many trainees who have this affinity for teaching. They love being an educator, and we have a lot of system-wide subject matter experts in medical education, in teaching and practicing sort of both the science and the practice of medical education. But for me, having finished fellowship many years ago now, I felt like at the time, and many of my sort of contemporaries felt the same way, that many of us had to cobble together this education through various resources. So we developed this system-wide course for fellows in our institution called the Health Professions Education Pathway, taking these naturally talented fellow learners and trying to help them sort of launch their careers as educators. This was internally funded, and I can speak a little bit more about that later. And what we did is develop 14 interactive modules that were delivered over 12 months. It's a hybrid program. 75% of them are delivered asynchronously, with also a synchronous online check-in, and then the other 25% of them are synchronous online. So really just this kind of sort of longitudinal system-wide program to help people sort of develop foundational skills in clinician education. Next slide.